Hello, everybody, and welcome to Getting the Most Out of Your Botulinum Toxin Injections for Blepharospasm. I appreciate everyone who's with us today. My name is Charlene Hudgins. I am the Executive Director of BEBRF. Before we get started, just a few things. I want you to know that this webinar is being recorded. It will be put up on our website once it is edited. If you have any questions at the end when we have the question and answer session, please submit them through the Q&A icon that you get with your Zoom. And then finally, I just want to make a little disclaimer here. I am not a medical doctor. I have watched hours and hours of doctor presentations, gone to webinars, been at in-person presentations and workshops, and I have talked to literally thousands of blepharospasm patients. This webinar is the culmination of all that learning so that it might help some people get a better experience with their botulinum toxin injections. I just wanted to be upfront with that. Since I am not a medical doctor, there's a very good chance I might not know the exact answer to a question you have at the end, but if I don't, I'll write it down and I'll find an answer for you, all right? This webinar is designed for two groups of people. One, the newly diagnosed and patients who hope to find more success with their ongoing injections. And I'm even going to address a little bit about what happens when they worked at one point, but they're getting less and less effective and to even not being effective at all anymore. There's some things that you can try that can return you to some effectiveness. So you're newly diagnosed and your doctor has said to you, it's an incurable neurological disorder, but don't worry, there's a treatment. And so you go in for your first injections with great expectations of completely resuming your normal life. And that's not what happens. The reason is because there are so many variables. So you need to set realistic expectations of what that first injection cycle is going to be like, especially if it's the first time with a new doctor. It sometimes takes 4 to 6 injection cycles to get the correct variables. Now, I realize if you're getting your injections every 3 months, that could be a year to a year and a half. But what we hope to do with this is help you find ways to make that happen faster. So what are these variables? The most obvious ones are, where do the injections go? So the injection sites. What dosage is put into each injection site? What is the injection technique? Does the doctor come from a specific angle or whatever? And those are all things that are going to be different from each person. And then finally, what type of botulinum toxin are they using? There are 2 types that are approved by the FDA for blepharospasm injections in the United States. The one that usually people refer to as Botox, but there's also Xeomin. There are 2 other botulinum toxins out there. One is called BioBlock and the other one is called Dysport. They use those a lot in other countries, but they are not FDA approved in the United States, which means if your doctor decides that he wants to try Dysport on you, it's going to be what is called off-label. So that means your insurance might not pay for it. So those are some factors to consider. Now, while the 2 botulinum toxin molecules of Botox and Xeomin are identical, there are factors that make them different. Botox was developed first in the 80s. It was called oculinum and then later Botox. And it occurs in a very natural state, meaning not only is it the botulinum toxin molecule, but it also has the naturally occurring antibodies and peptides. Xeomin was developed around 2008, and it strips away those antibodies and peptides. So the reason why which botulinum toxin might matter is over time, and it takes a great deal of time, you cannot build up a tolerance or immunity to botulinum toxin, but you might build up a tolerance or immunity to the peptides or antibodies. So that might be a sign to change to Xeomin. All right. So basically, in order to help your doctor find these variables more quickly and get you going on a proper treatment more quickly, the purpose of this webinar is for you to help your doctor do it. The bottom line is, do not doctor hop. I can't tell you how many people have called me and said, about 10 months ago, I got diagnosed with blepharospasm. I've had 3 sets of injections. They haven't done any good. And I will always ask, are they all with the same doctor? No, it's 3 different doctors. Well, that's your problem. Think of working with your doctor as a kind of a relationship. They've got to learn you, you've got to learn to communicate with them, just like kind of like a marriage, okay? And here's the thing to remember about doctors. They want to do a good job for you. They're human beings. They want to do a good job for you. They want to do a good job for you because the vast majority of doctors really care about the quality of care that they're giving, but also, you know, they're people. They want to take pride in their work. So here's how to help them help you. So first of all, when you are having a day with your absolute worst symptoms, this is as bad as they get, whip out your smartphone and take a 90-second video of what that looks like. You do that because you will not look like that when you go into the doctor's office. So this other work, if you don't, the doctor is relying on your verbal description of what your spasms look like. And as you may or may not know, in blepharospasm, there is nothing that is one size fits all. Nobody has spasms like anybody else. There's not one medicine, one exercise anybody can do that some people find successful that everyone will find successful. So every person is different. Now, when you take this video, a word of warning, do not narrate it. The act of narration will alter how your spasms are presenting, okay? So take a video and take that with you into the doctor's office. The next thing you want to do is make sure you are walking out of that office with a facial map. And on that facial map, you want to get the exact locations of every injection and the dosage amount at each location. You also want to make sure you put the date on the map. And this can be the first part of your record of this injection cycle. So you want to document your injection cycle, okay? Write down the things that happen. So let's talk a little bit about how to document. Okay, what is the format for proper documentation? That's up to you. Some people will keep a journal and write like that. I always tell everyone, you do not need to write the next Jane Austen novel. You can do it on a wall calendar with big squares where you can put little notes in each square if you want to. But the format doesn't matter. I know someone who does it on Excel spreadsheets. Whatever format you want, but keep a record because you want to remember some important things to tell your doctor 3 months after the last time you saw him, okay? So what do you want to document? You want to document side effects. You want to document when they came on and how long they lasted. Some typical side effects include blurry or double vision, drooping eyelids, the ptosis that you can see right here. Sometimes this isn't very typical, but every once in a while I'll have people tell me they have sinus issues, that maybe an injection went a little too close to a sinus cavity. Often I tell them, well, that could be so you might want to mention it to your doctor, but it also could be a coincidence that you're having sinus issues. And then some people will call me and report that they can't get their eyes to close at all. And you certainly want to tell your doctor about that. And anything else that's unusual that happens. And the reason you want to write it down is because if something happens 2 weeks after your injections, 2.5 months later, what are the odds you're going to remember that? So write it down, but also be aware that your doctor is not interested in your journal. So what you need to do is go through before your next injection cycle and figure out what are the important points that you can share with your doctor, because a lot of doctors will do all their injections on one day. So make sure that you can keep it as brief as possible. Okay, here are the most important things to document. When did you feel the botulinum toxin kick in? The first moment you felt any kind of result. Being aware, it can take a couple of weeks for that to happen. Some people will walk out of the office and it's already taken effect. For some people, it might take days or even a couple of weeks. So note that in your journal. When it reached peak effectiveness, if you could tell. Sometimes it's hard to tell. Is it there yet? Is it there yet? But when you think it's gotten there, make a note of that. When it started to wear off, that's an important piece of information. And most importantly, when was it completely worn off? These things can inform dosages, especially. So make sure you tell your doctor these things. Okay, now I've talked a lot about journaling and the facial map. And right now I am going to turn the screen over to Angel, who is our webmaster. And she has put some things on our website to help you do all of this. I will be back after Angel is through because I still have a lot of more information to share.
All right, so you're on our homepage of the website. And what you're going to do to get to that location is you're going to hover over about blepharospasm into injection advice. Once you get there, you're going to see why won't my injections work. And the first things that you're going to see here are injection tips, which is really what Charlene just went over. This is going to be the section about your injection journal, which I will show you the injection journal in just a moment. And then we have a section here on common injection patterns and techniques, which includes a little facial map that have spots where typical injections can be placed, as well as in video where you can watch injections being done. And if you're wanting to get your injections more frequently, our board member Jane has put together some information to help you get that done. So here's just a little section on here, as well as all of the articles that she has put together to help you. So now we'll go back up here and I'll show you the injection journal. Okay. This tells you how to fill out your injection journal, which is what Charlene just went over, as well as your facial map. So you'll want to print out multiple of these, as well as the next part, which is the calendar. And you can use this to document all your information. All right, Charlene, back to you.
Thank you, Angel. Okay. Going on. One thing you should know about the packet for getting more information or more frequent injections is that this is what your doctor can use to justify the request to your insurance company to get more frequent injections, and to also document that it's safe to do so. Okay, I want to have a word about dry eye. Now, a lot of people who have blepharospasm have two accompanying conditions: dry eye and photosensitivity. Dry eye, if you have it, you must be treating it if you want your injections to work. The dry eye can keep your, if you're not addressing it, can keep your injections from working as effectively as they might be. So make sure that you are treating your dry eye in every way your doctor suggests to try and help the injections work better. One thing that's kind of interesting, I went to a dry eye workshop at the Ophthalmology Academy last November, and one of the things that I found out is that the incidences for diagnosing extreme dry eye, as it's called, or they were calling it EDE, have tripled in the last decade due to the proliferation of digital devices. So what we're seeing is a downward skew of age with regards to the diagnosis of EDE. I don't think it would be too much of an extrapolation to say that if someone is predisposed to have blepharospasm, and perhaps it would be triggered in their case by EDE, that we might also see a downward skewing of diagnosis of blepharospasm cases as well. But always make sure that you are treating your dry eye. Some people use all different kinds of lenses, scleral lenses, prose lenses, different drops, different gels, different washes. Some people sleep with moisture goggles. Some people, their eyes don't close properly, so they'll sort of tape them down and put a mask over it. Just make sure that you are treating the dry eye, or you're going to have less success with the botulinum toxin injections. I want to talk a little bit about the numbing creams. Some people use, this is probably the most common one, EMLA, numbing creams before they get their injections. And their doctors have different thoughts on whether or not you should use numbing creams. There are some doctors who believe if you use a numbing cream, it's probably going to make your injections less effective. And there are other doctors who say there's probably no correlation for that idea. Basically, the best advice I ever heard was from a doctor who said, even if the numbing cream takes just a fraction away from the effectiveness of the botulinum toxin injections, if you get too much pain and too much anxiety from the pain, go ahead and use it. Sometimes your doctor's office will have this in their office if you ask for it. I think you can buy this on Amazon if you want. And now I want to talk a little bit about zinc. Now, doctors are divided on this too. There are doctors who think that absolutely you should up your zinc intake before your injections, because zinc has a chemical reaction in the body with the botulinum toxin that helps it spread and adhere where it needs to go. And then there are also doctors that say, I can see no discernible difference through using zinc. Just in case your body does use zinc in a positive way for your botulinum toxin, I generally tell people 5 days before and the day of your injections, you should take a 50 milligram zinc supplement. And it should be in pill form, not lozenge, because lozenges are poorly absorbed. Okay. You can get zinc anywhere. You can get it at Walmart. You can get it at a drugstore. You can get it at a health food store. But a 50 milligram zinc supplement will help bolster your zinc in your body before your injections. Now, having said that, there are some foods that deplete zinc in your body, and there are some foods that preserve zinc in your body. So for those 5 days and the before and the day of, just those 6 days, every injection cycle, what foods should you avoid? Well, you should avoid foods made from grains like breads, cereals, oatmeal, rice. Those are foods made from grains. So avoid those, just those 5 days and the day of injections, and then take your zinc supplement. You should avoid nuts of all kinds, and you should avoid legumes of all kinds. And again, it's just those 5 days before and that day of, so that your zinc supplement will stay high, or your zinc body content will stay high. So what foods are good to eat to keep your zinc level high? Well, turkey. Turkey is your new best friend. Okay, now I'm not saying you should have Thanksgiving 4 times a year, every time you get injections, but you should not eat processed turkey. So stay away from the Oscar Mayer aisle. You can buy a turkey breast and bake it, and that can last a couple of days, and you can do all kinds of things with it. But turkey helps preserve zinc. Also, potatoes. Potatoes help preserve the zinc in your body. And finally, certain fruits like apples, bananas, and pears. Those are very, very good food. These turkey, potatoes, and fruits are very good ways to keep zinc in your body, especially if you really want it high for your injections. Okay, what kind of doctors treat blepharospasm? I'm asked this all the time, and I see it on Facebook pages like that are forums like Living with Blepharospasm, etc., where they say, I've heard you should only go to this kind of doctor or only go to that kind of doctor. Well, there are basically 4 kinds of doctors that treat blepharospasm: a neurologist, an ophthalmologist, a neuro-ophthalmologist, and an oculoplastic surgeon. Okay. Having said that, not all of these doctors, not every neurologist or ophthalmologist, etc., is going to be familiar with blepharospasm or how to treat it. It would be great if your treating doctor was an expert on blepharospasm and also a movement disorder specialist. Okay, that's a sort of a separate kind of category. But you're not a neurologist if they've got a lot of experience treating blepharospasm and they're doing well for you, doesn't necessarily mean they're a movement disorder specialist. And I want to give you a little word of caution about. Everybody keeps saying you got to have a movement disorder specialist. You got to, so you go looking for one. So I want to have a little word about that. It's great if you can find a movement disorder specialist who is a blepharospasm specialist, but not every movement disorder specialist is. They might be a cervical dystonia specialist, or they might be a whole body dystonia specialist and not really know all that much about blepharospasm. So I guess when you're looking for a doctor, the important questions are, how many blepharospasm patients do you treat? Okay, that I think that would be a very good question, especially if you're contemplating changing doctors. Question to ask is, do you have apraxia of the eyelid opening? Okay, for those of you who may not have know what apraxia of the eyelid opening is, I always, when people are trying to understand blepharospasm, I say generally the symptoms present in one of 3 ways. There's the ultimate clenching of the eyes, there's the heavy blinking, and then there's just the soft close, and you can't open your eye for anything, and you start working this muscle right here called the frontalis muscle, and you're just working it in hyperdrive, and over time you can damage it just trying to lift your eyes open, but they just close and will not open back up. That is apraxia. One thing that I want to show you guys, this is that video that Angel was showing you. I hope it runs. I don't see the start bar here. How do I have to fix something here? Anyway, the school of thought for injecting for any kind of blepharospasm, apraxia included, used to be that you never inject along the lash lines. They thought up until recently that if you did that, it would increase the chances of having ptosis or eyelid droops. But recent research has borne out that the exact opposite is true, that is especially with apraxia, but it also works for other blepharospasm injections too, the exact place where you should be injecting. So I'm going to show you this video. It's only about 90 seconds long of someone being injected for apraxia and blepharospasm. I will give you a warning if seeing needles go into somebody is scary to you or distasteful to you, you might want to look away for a minute, and I will let you know when the video is over. Okay. Notice the technique, the side entrance technique. That's what I was talking about, different techniques. And your doctor should also be using the smallest plastic surgeon type of syringe possible. Okay, good. Okay, this video is available on our website, as Angel showed you. Feel free to download it and take it to your doctor as an example. If your doctor still says, I was taught that you never do that, there are two things that you can tell your doctor. This is Dr. Jenna, the head of neurology at Emory University, who is doing the injecting here, who's given us permission to share this video. And we also have a couple of research articles that we could share with your doctor if they wanted to see concrete proof. As I said, the thinking used to be that if you shot along the lash line, you're just about guaranteeing to give the patient ptosis, when actually the research now shows that it is less than 7% of the people get ptosis from injecting along the lash line. So that means 93% are having more success. So just contact us and let us know if you have any questions or want that those publications. Is there ever an appropriate time to change doctors? Well, obviously, if you move or if your doctor moves or retires, but a doctor who won't listen to or even consider your input, that might be a doctor that's not, because you're not going to be able to help him with all the stuff you've learned today. So that might be want to cause you to rethink that relationship. If the doctor is genuinely listening to you and still is unable to find that the perfect combination of variables after 6 times of trying to do it, you know, then you might want to start and look around and see who else is in your area who could do it for you. Okay, I want to talk a little bit about a misconception that especially newly diagnosed patients have, and some people who've had blepharospasm for a while. They're trying to weigh the options of injections versus surgery. Should I get the Botox injections or Xeomin injections, or should I get the surgery? It's not an either or, okay? It's not an either or. Remember, blepharospasm, even with surgery, is still an incurable neurological disorder. Surgery is designed, if you're talking about the myectomy, where you move a part of your eyelid, both muscle and tissue and skin, is designed to help your injections work better. So getting the surgery doesn't mean you don't need the injections anymore. You still will need the injections. You may not need them as often, and you may not need as much botulinum toxin in the injections, but you will still need it, okay? It's very few people get the surgery and never have a need for injections again. So keep that in mind. We also tell people that myectomies are the treatment of last resort. Okay, you need to exhaust all other possibilities to do that. One, you're removing permanently a part of your eyelid. That could have all kinds of ramifications. Your eyes may never close properly again. Okay, they might not close entirely when you sleep. That's a possibility for some people. There's also the possibility of creating scar tissue. So if you create that scar tissue in there, then that really narrows the number of places that you can inject for your ongoing spasms. And as Angel mentioned, we have created a packet of information your doctor can use to appeal to your insurance company or Medicare for more frequent injections. I just wanted to say that one more time because we've been saying that for a couple of years and people are always surprised when they hear it. So before we go to the Q&A that you people are writing in your the Q&A icon, there's just one more thing I'd like to cover, and I intimated at the beginning that I would be covering this as well. What happens if at one point you were getting fairly effective botulinum toxin injections, but you've noticed lately that the effects are diminishing over time and maybe have even stopped? How do you address that? Well, the best way to address that is the way you addressed your spasms at the beginning of the cycle. You whip out your smartphone and you take a video of what you look like now. Okay. And if you can, save that first video from when you started the treatment. And if you could take both those in so the doctor can see side by side, he's going to notice that one of two things or both have happened. One is the nature of your spasms have changed. You're not spasming in the same way that you were at the beginning. That's one thing that could have changed. The other thing that might have changed, well, probably has changed, is we are all aging, and the doctor sees you every 3 months. That's not really long enough to notice any change in the aging, but you see someone every 3 months for 5 to 10 years. You might not have noticed over time that maybe the skin tissue and the underlying musculature are aging, and consequently, that may require some adjustments too. So that's the best way to address that with your doctor. Now, let's go to the Q&A. Our neurologist said that FDA says not to use more than 48 units of Botox without some approval. Also, he said FDA says Botox should be injected every 3 months, but not less than 3. Is this correct? It is not. I know people who get 100 units of Botox around their eyes, and I know that some people who get it as frequently as every 4 weeks. I am getting injections for the first time this week. What should I expect the day after the injections? Any special aftercare? I think in general, it's probably a good idea not to rub your eyes for at least a day. You know, just let that all sort of settle in. So that's probably one thing that I would advise. I don't see any problem with using hot or cold compresses afterwards either, although some people will try not to touch anything for at least 24 hours. And what to expect the day after, it just depends. It just depends. It's different for every person. So it'd be interesting if you would, you know, share with me what you did experience the first time. Okay. I am a vegetarian. Do you have any suggestion concerning plant proteins that are as zinc friendly as turkey? Sadly, I do not. That's why I started including, I used to just say turkey. Now I say the potatoes and the fruits. I don't know. I'm not a vegetarian, so I'm not familiar with what plant proteins might be out there. Sorry. But let me write that down and I will try to find out. Okay. Was the zinc recommendation 15 or 50? 50, 50. Can we develop immunity to Botox? No, you cannot. But you, as I mentioned earlier, Botox has the naturally occurring antibodies and peptides. It's possible that you could develop immunity to those. And Xeomin strips those out. Is there a particular type of zinc? No. Any kind that you take as a vitamin supplement. Should you blink a lot the first 15 or 20 minutes after the injections? They say this when using cosmetic Botox. I've not heard that, Jane. I've not heard that at all. But ask your doctor. That's a good question to ask your doctor. Latoya, How many milligrams of zinc per day during the 6-day period? 50 milligrams once during those days? Yes, 50 milligrams once a day in pill form, not lozenge. Can dry eye be a result of blepharospasm? I think that the answer to that is probably yes. One thing that's interesting that's different for people with blepharospasm and dry eye. The natural flow of the tear film across the eye is from the upper outside down towards the lower inside where the tear duct is. That's the natural. We blink so fast that we can't really see what's happening. But if you catch someone blinking and then put it in slow motion, you'll see that's exactly the direction that people are blinking from. I learned this in that workshop as well. They go from the upper outer eye to the lower inner eye. That's the natural direction that the tear film is pushed. With blepharospasm, the blink becomes more horizontal, like that. And so what's happening is the flow of the natural tear film is not allowed to go in its natural way. And so it could be that blepharospasm could be the cause of dry eye, I would guess. My first doctor who performed injections was injecting several places across my forehead. My second doctor said, no, the injections in the forehead can exacerbate the symptoms. Okay, different doctors have different views on that. So, you could have 10 doctors lined up and you could ask them that question and some will agree and some will disagree. That's just the only answer I could give for that. I have developed puffiness under my eyes. Could this be from my blepharospasm? I don't think so. I have puffiness under my eyes. Okay, brace yourselves. See, I've got a lot of puffiness and I don't have blepharospasm. So I doubt that is the cause. Watching TV is almost impossible. Anything I can do to help that? Well, I know on TVs, they sometimes have all kinds of controls and that you can darken the screen or brighten the image or do those kinds of things. So you might want to play with that. Other than that, I really don't have any advice for you. One thing that you might find helpful is if you can find those programmable lights. They have lights that are programmable and they are operated through an app on your phone. And you could, through that app, you can control not only the brightness or intensity, but you can also control the color. And perhaps putting a soothing color on around in the room around you might help with the TV. That's just a guess. Oh, and here's Peter. Thank you, Peter. Blinking will spread the toxin, which you want with cosmetic, but you don't with blepharospasm. So there's your blinking question answered. Can dry eye be the sole reason for blepharospasm? No, not everyone who has blepharospasm has dry eye. Is there an article about eyelash injections not causing apraxia, but having the opposite effect that I can give my doctor? Yes. Yes. Just drop me an email, Charlene@blepharospasm.org, and I'll get those articles to you. Have you heard yes through forehead or no? My current doctor does 4 injections near corners of the brow. I've heard different things from different doctors. So, like I said, not only is there not one treatment for everyone, not only does blepharospasm present differently for everyone, doctors have their own opinions on these things as well. Can sleep in prone with my eyes pressing on the pillow? Well, the thing of it is that I don't know if that's the way you want to sleep, or are you looking for a way to sleep that will help your blepharospasm? Now, the truth of the matter is the blepharospasm stops when you fall asleep. So I'm not entirely sure what you are asking there. If you want to clarify a little bit. Where to inject also depends on the symptoms they see. For example, above brows. Yeah, that's a good answer, Peter, for Pam. You may have spasms in the area related to what injecting in the forehead will help or not help. I watched Dr. Jenna, who did the injection video, do a presentation the other day, and he says by mere observation of the blepharospasm as the way it presents both in the office and if they bring a video, you can tell a whole lot about where you inject, and you're never going to inject the same way on everybody. So thank you, Peter. Is there a procedure to unclog tear ducts? I know there's a punctal plug procedure that's supposed to help with your dry eyes. Peter will know. I'm sure he'll tune in and tell me in a minute. Great job today, Charlene. Thanks for your time. Oh, you're welcome. Thank you very much. Oh, here's a good idea. The person who spasms watching TV could try a trick like chewing that offsets the spasm. Chew gum. That's a good idea. Any update on the extended Botox they're developing? Yes, it's Daxi by Revance. Theoretically, it's going to last for 6 months when you get it. Pandemic slowed everything down for FDA approval. They have gotten it approved cosmetically. They have not been able to get it approved therapeutically yet. I talked to them a couple of months ago, and they were in the process of working on that approval. And hopefully soon they will have that. Sudafed work for others. I've heard people talking about using Sudafed. I don't really know that much about it. I'm going to be honest. My son's neuro-ophthalmologist denies this treatment for my young adult son who has blepharospasm. He is developmentally disabled and would need this under anesthesia. Doctor believes that he would suffer ill effects from this treatment. His eyes have remained closed for most of 2 years, and though he would have vision, he is now functionally blind, which adds significantly more challenge for him. Other neurologists and ophthalmologists he has seen refuse to address this condition. Are there any other options that will help him? Wow, that's a very unique question. And sadly, what I don't have the answer for. If the doctors are refusing to treat him, I'm assuming there's a reason for that. So, I don't really have an answer for that one. I apologize. But I don't even know where I would go to find that out. I have both blepharospasm and apraxia and have been told that Botox will not work and that the only solution is the frontal suspension operation. What is your opinion? I have tried Botox twice so far, but without success. Your presentation plus video has caused me to rethink this. Okay, here's the deal. I get called all the time by people who've had 2, maybe 3 injections, even if they're all from the same doctor, and said, it's not working for me. It's too soon to tell. It's too soon to tell. And here, I'm going to give you some tools like I did in this presentation that could help you maybe get a better result from your botulinum toxin. So as far as frontal suspension surgery, I hear people who think that was a great thing and they were glad they did it. I've also heard patients say it's the worst mistake I ever made. It's basically where they go into this muscle up here and that goes under your brow, and then they put a sort of a device in there that will lift it up. I really I don't have an answer for you, but before I would do anything surgically, I would give what you've learned today and take your video, especially since you have apraxia, take the 2 videos with you, one of what you look like on your worst symptomatic day and the video of the injections to your doctor's office, and show him both things. And if you need the underlying articles that support the eyelash line injections, just let me know. My doctor is a neurologist, movement disorder specialist, and Botox injector for dozens of patients, and he does not inject in the brow. Well, I don't know if that's a blanket policy of his, or maybe just you don't have indications for it. I tried CBD gummies and it did help. Is there any more information available regarding this study? As some of you may or may not know, BEBRF funded a CBD study that was recently completed. And I believe the doctor is writing a paper for, I believe it's the one of the big journals, which one escapes me. And as soon as she does that, we'll let everybody know and see if we can get a copy of it so that we can also share it with everybody. Please spell the name of the inject. Oh, it's Dr. Jinnah, Jinnah. His first name is Hyder, Hyder. He goes by Buzz, B-U-Z, Buzz Hyder. He is the head of neurology at Emory University in Atlanta. Yes, Peter says, yes, there is a procedure for plugged ducts. Don't remember the name. People also do things like hot compresses to help that too. Something else that might be helpful, just as a thought, all along inside that little flat part of your inside of your eye, that little flat part where that your lash is attached to, there are glands called meibomian glands, and sometimes they get clogged up. So sometimes you can just sort of roll like this and unclog them top and bottom. I wouldn't do it right after you have your injections, but sometimes that will unclog them, and they excrete certain oils that are really good for your eyes. To clarify my question about prone sleep, does sleeping in the prone position after having injections, my injections, not advised? I've never heard that. I said brow, but meant forehead. Okay. Please spell Daxi and Revance, the new treatment you mentioned. Daxi is D-A-X-I. Revance is R-E-V as in Victor, A-N-C-E. What do you know about eating low histamine foods to help with spasms? Some people take Benadryl, an antihistamine, so it would make sense that low histamine foods might help. I haven't heard that, but Dr. Soparker in our very first webinar addressed a lot of these sort of outside issues. And he says, I don't have patients who do that, but if it works for you, keep doing it. So if that's what's working for you, keep doing it. Do you think magnesium helps? I have an article that Dr. Soparker, as it would happen, that says that it's on nutrition, and magnesium is one of those things that can deplete your zinc. But I've also known people that say that instead of zinc, they put, their doctor has told them to focus on magnesium in their body. So like I said, there's stuff all over the place. Apraxia is very hard to deal with. Lash line shots, frontalis sling, and myectomy are all possible approaches. But as with so much regarding blepharospasm, it varies by patient. Thank you, Peter. Botox seems to change my whole face as far as smiling is concerned. My eyes just don't smile anymore. Can't believe the difference in pictures. I'm sorry if that's bothersome to you. I have taken magnesium citrate, and it's great because you sleep, but it does dry out your eyes. So there's that. Thank you for sharing that. Is there a Canadian organization that is active about this issue? No, there is not. I have found your information very helpful. Our Ontario Medical Care will only pay for every 10 weeks, plus a day or so every 11 weeks. When my doctor only does it once a week, I think I need more frequently. So we'll have to pay for the doctor. I'm over 65. Part of your answer is blocked by the person trying. Oh, there it is. I think I need it more frequently, so we'll have to pay for doctor, but the drug is covered probably because I'm over 65 and it is for a medical condition. There is not a BEBRF version for Canada, I do have a lot of patients in Canada who reach out to get information from us. The information for getting your injections more frequently does not based on what country you live in. It is based on the science of getting the injections more frequently. So if you think that would be helpful for you to get it more often, be sure to contact, you can look it up on the website where it is there, or you can contact us and we'll get it sent to you. Thanks so much. Very helpful about the foods to avoid before shots. Okay, so I think that's the last question. Let me see where we are on time. Oh, that's kind of perfect. I hope I've been helpful for you. Barbara Bohr, I'm going to try and find some plant-based proteins that are good retainers of zinc for you. I think that's the only question I wrote down that I need to find an answer for. Before we go, I just realized I just got a message. Let me see. Yes. Someone has shared with me that their doctor recommended, if you're going to take a zinc supplement, make sure it's zinc citrate and not zinc gluconate. Zinc citrate is the one that you want to take. All right. So before we go, just a couple of announcements. Number one is our BEBRF symposium in Phoenix. It's coming up. It's going to be so good. October 21st and 22nd. Dr. Padma Mahant is the program director, and this show has been sponsored by MERS Pharmaceuticals. And then finally, don't forget, your donations make programs like this possible. So please, if you can, donate to BEBRF. Thank you and for joining us, and have a nice weekend.